Welcome everyone. As people are trickling in here, we'll take a couple more minutes to wrap up the thought exchange. So if you haven't had a chance to do that yet, the connection information's on your screen. Go ahead and go there and share thoughts and rate thoughts. And when that timer is over, we'll go ahead and start answering questions. If you're just joining us, we're just waiting a minute for people to get connected into the meeting. You can see that timer on your screen and connection information for the thought exchange. At the end of that timer, the thought exchange will close and we'll get started. All right. Thank you to everybody who's been able to connect and share their thoughts and rate thoughts. Obviously, we're trying out a new tool, and we'll see if this is helpful for these kind of interactions or not. We'll see how that goes. But I do appreciate that we had 465 participants, so they shared almost 500 thoughts and almost 40,000 ratings. So that's awesome. So thank you very much for participating. You guys figured that out very quickly. And I'm just really looking forward to seeing how well it works and see if this is a viable tool for the future as well. So we'll get into the questions in just a second. I want to share a couple updates. The one thing I want to make sure that you're aware of is that our COVID reporting dashboard is now live. If you go to the csdecatur.net homepage and to the opening 2020 page, you'll see a link for COVID reporting dashboard. And so this is where you can find information about cases within the school system. The left side is about actual cases or probable cases. So people who either have a confirmed test for coronavirus or they have a probable case of coronavirus that maybe hasn't been confirmed by a test yet. And then close contacts, which we find out through our contact tracing protocols. You can see how many are currently isolated or quarantined on any given date, and this updates each day. And you can see over time what the data look like. You can see a cumulative count by location, and so this will just continue adding as time goes by. And then you can also see narrative statements that describe particular cases of where did we have a case and what were the quarantines involved with that case. So we hope you find this helpful. Please feel free to share feedback. We are working to see if there's data from before that we could include here. We focused the dashboard on the current school year, the 2021 school year, but some folks were asking questions about whether or not we had data from the summer, for instance. And so we are working on that. So you may see the dates go back once we find all the records from those and get it updated. But in the meantime, we hope this is a helpful way for you to kind of keep track of what's happening within the school system itself in terms of our coronavirus data for our staff and our students who are here present in our school system. So the other thing I wanted to share quickly, if you have not already found it, is the information on our COVID-19 Stakeholder Planning Committee is also in this same area. So if you have not had a chance to look through this, please feel free. There's minutes here, there's information on the subcommittees, and this is also one of the spots we will post our report when we have a final report. There we go. When we have a final report from the committee, and we'll talk about that a little bit more tonight, I'm sure. So I think that is the gist of what I wanted to make sure to share before we get started with questions. Let me check my notes here. Yeah. All right, so let's go ahead and get started. So the way Thoughtexchange works, if you haven't already figured it out, is people can share whatever thoughts they have. And in this case, we prompted with the question, what question would you like answered at the next town hall? And so people can put in the questions and then anyone can rate those that are put in. And the concept is that hopefully those that are the most pressing will rise to the top. And that's what we can focus our time on. We'll get through as many questions as we can. I'm guessing we'll probably see some themes in questions. And so when one question gets answered, it may actually answer several questions. And so I may look for some themes and answer them together where it makes sense to do so. The ratings come from the star ratings. So if there's anybody on the town hall who did not participate in the Thoughtexchange, I just want to make sure you understand where these ratings come from. Anyone who did participate was able to go and put their questions in, and then also rate thoughts of others. And so you'd see a whole bunch of thoughts, and that's why there's so many ratings. Because each person can rate all the thoughts. So I appreciate all of the effort that went into that. If you didn't do it this time, hopefully you'll do it next time if this tool works out and we're able to use it again in the future. All right, so what we're going to do is kind of go through the top several questions to look if there's some themes there, and then that's what I'll address. So as you can see here, a couple things. You can see the questions or the thoughts that were shared, and then you can see their average rank and also how many people ranked it there. So if we look through these top questions here, we see when will you announce a plan for January? What are schools doing to protect teachers and staff who are high risk? Is CSD able to accommodate teachers who wish to remain virtual by pairing them with students who wish to remain virtual? On what date will you provide the next reopening plan to the community? Because some teachers and students want to be in person and some want to be virtual, we should allow an option for both. Not really a question, but I get the idea. Can CSD work or request the City of Decatur Commission make schools priority, not bars and restaurants? What will happen if and when more students opt to return in person than a classroom is able to safely fit? When do you anticipate making a decision? When we make a final determination as to whether students will return. Okay, so it looks to me like there's a kind of a common theme right off the bat of when are we going to announce the plans? So let's start with if I can get this to work here. Let's start with this one, and we saw several that were similar to this. So let's talk a little bit about the timeline for announcing plans. So a couple weeks ago, we started our COVID-19 Stakeholder Planning Committee. And so we've had somewhere around 60 to 70 people, I think, I haven't counted recently, but who stepped up and volunteered to be a part of that committee. And we split up into subcommittees. And so we have committees working on many different areas. They are working on metrics, they're working on virus testing, they're working on mitigation measures, communications, and then we also have groups we have a group focused on students, a group focused on parents, and a group focused on employees. And so they've been working very hard and very quickly to come up with recommendations to help us make our decisions as we move into our next phase. And so we had our final meeting, let's see, today is Thursday, so last night. And our goal is to try to pull a report together tomorrow. And so the subcommittees are working on their basically sub-reports, and then we'll pull that together as a full report. We'll probably have to work on it over Thanksgiving break, I would guess, before it's completely ready. And we'll pull all that together. And so right after Thanksgiving break, we will release that report. And so anybody can see what the recommendations are from that committee. We will, that same week, so not next week, but the week after, we are planning to have another town hall, just like this one. And if this works well tonight, which so far so good, we'll go ahead and do Thoughtexchange again. And that way people can ask more questions and we can focus on the highest priority there. So next Thursday, or 2 weeks from tonight, we will have another town hall. We are also working to get a board work session scheduled so that there is an opportunity for the board to ask questions and for the board to provide their input on whatever future plans we have. And we're also having a teacher advisory council meeting next week or in 2 weeks. So we've got a lot of stuff going on. So we've got the report, we've got various meetings for input and discussion. We've got another town hall. And then as soon as possible after that, we will be announcing what our plans are. And so in terms of timing, we are not setting a specific date because we want to make sure we have the time we need, but we also recognize that the sooner the better. Like, people really want to know what's happening and we totally understand that. But we also want to make sure we're making the best decision we can with the information available. So, so in general, to those questions that are asking, when will we know what's happening in our next phase? Probably maybe the week after Thanksgiving, but for sure by the week after that. And so that is the timing of those plans. Does anyone from the admin team have anything to add there that I might have forgotten? Feel free to jump in. All right. I didn't see too many with this one, but it was near the top. So let's go ahead and talk about this one. What are schools doing to protect teachers and staff who are at high risk? And so there's a couple things, and there are some folks on the call who may be able to jump in and provide more details, but in general, one of the primary things that we're doing is working on mitigation measures. And our current mitigation measures are things like personal protective equipment, masks, shields, the plexiglass dividers, things like that, that we're putting in place. Obviously, we have ramped up cleaning processes and equipment. We have made significant changes to our HVAC systems, which we can talk through and discuss a little bit. But particularly as it applies to teachers and staff who are high risk, we have an accommodations process where they can put in for an accommodation, and we review the circumstances and do our best to find a solution that will work for that teacher and what their accommodation request is. Obviously, teachers especially, it's very difficult when we can't have a teacher available to do a class. It very much affects our operations differently than other staff members. And so we are doing some things to try to make sure that as we accommodate those needs, we can also keep operating as a school system. So we are posting positions to hire additional teachers, so that when we do get to the point of hopefully being able to transition back at person at some point, we will have onboarded some folks that we can then turn to help support some of those classrooms where we've had teachers that are at high risk, so that we can provide more support there. And we are also onboarding a lot more, just other helpers, substitute teachers, paraprofessionals, those sorts of roles, who can step in and help. For instance, if a teacher needs to be virtual, but there are students in the class, someone who can be there with those students, depending on what the scenarios look like that we end up with in the future. Sergio, would you mind telling us briefly, just give a little bit of an update on what we're doing with our HVAC system so people can understand some of the improvements we've made in that area?
Sure, Dr. Duri. So in the district, we use S-ray standards, which specifies the minimum amount of outside air in a specific building occupancy. Normally, the standard talk about 10 CFM, which is equivalent to 3 air changes per hour. But we increase the outside air in our units, and we schedule the units that start working 2 hours before building occupancy. And additional, we make adjustments to keep this unit running constantly during the whole occupancy day. So basically, the unit will be creating more air exchanges during the day. As Dr. Dewey stated, we install the ionizers in all buildings. We are scheduling some UV lights for some classrooms, and we are looking into the air purifiers for some other classrooms.
Awesome. Thank you, Sergio. Maggie, would you mind filling us in just briefly on the accommodations process, so folks can have a little better idea of what that looks like for our staff members?
Yeah, I'd be happy to. Thanks everyone for tuning in. We have had several meetings with staff members who have submitted their requests for accommodations. We had probably about 150 total requests for accommodations when we were initiating the process. We were able to accommodate most of those through the local school teacher meetings with the principals. The principals met with their teachers. They offered additional mitigation strategies such as N95 masks. They looked at also the opportunity to make sure teachers who were concerned weren't going to be around students that were eating lunch. So if students were having to take off their masks during lunch, then the teacher didn't want to be in the room with those students, we were finding alternative locations for those teachers and someone to cover for those lunch classes. So lots of the principals were meeting with their teachers, going through the process and figuring out what other accommodations we could do for our staff. And we were really successful with that. And we were able to whittle it down to about 50 teachers or staff members across the district that were still requesting to work remote. And those 50 staff members received a packet. And what we have to do under Americans with Disabilities Act is complete an interactive process. And what that process means is the employee has to take a form to their doctor. The doctor looks at it, fills it out, gives us in the staff support department a little more information so we know exactly what we're dealing with these different employees. Then we take a look at the packet and have another conversation with the employees about what are some other options that we could possibly put into place to help support some of the needs that the staff member has. And if the staff member's doctor is very clearly saying that they are recommending the employee work from home, we have those on a list and we are working through those so that once we have plans for reopening, we have those on the top of the list to make sure that we find a place for them and how we can support them in their request to work virtual.
Awesome. Thank you very much. All right, let's go back here. Is CSD able to accommodate teachers who wish to remain virtual by pairing them with students who wish to remain virtual as well? Great question. And I saw some others in the list that look similar to that. So let's talk a little bit about where we're trying to be creative with our solutions and what some of the challenges are in doing that. So I know this has been a topic of several of the subcommittees of the Stakeholder Planning Committee. And they have been talking through, are there creative solutions that we could consider in what it looks like when we go back. And so the theory behind this is you've got a group of teachers that either want to come back, are able to come back, or those are not able to come back. And you have a group of students who have the same choice. Why can't you just pair them up? So the quick answer is we might be able to. If the numbers work out okay, we might be able to have kind of virtual classes and in-person classes simultaneously, but not combined together. I know there are a lot of concerns about concurrent learning, and I'm betting there will be some questions in there. And so we are looking for creative solutions around that. The problem is the numbers have to work out. And so one of the reasons why we are trying to onboard some more teachers is because if we can get close to that, and all we need is another handful of teachers to make it work, we want to already have those teachers on board in order to facilitate that. So I would invite, if there are any principals who would like to chime in on some of the creative solutions you've come up with at your school, not necessarily that you are ready to implement, but that you've talked about and that you have considered at your school. Anybody want to jump in and share any of those?
I think I've been designated.
Ruth, you always are the one who has to, aren't you?
So yeah, I mean, I just wanted to say that as far as like at the K2 level in elementary schools, I can't speak for middle and high, but that we are considering creative ways that we can do this so that we do have like the ability for teachers to not have to teach concurrently or to, have that feeling of teaching two classes at one time. And a lot of that, like the details of that can be worked out as we have a better idea of how many kids we'd have in the building and as we finish that accommodation process. So, but we are like doing a lot of running the numbers behind the scenes and figuring out how that could look. So, so I would just say that yes, lots of that talk is happening, and there are different things happening in secondary versus elementary, but that we know that this would be an option for us. So.
Thanks, Ruth. Appreciate it. Greg, I saw you unmuted. Did you want to share something?
Yeah, sure. Yeah, at the middle school, we are trying to work out a plan where we have teachers that that are in the building and they're teaching in person, but they have one period of the day that they teach to an empty classroom to the kids that are virtual. So in our plan, and we could definitely work it out where if there are teachers that have accommodations that need to teach virtually, we can definitely fit that in with our plan as best we can.
Awesome. Thanks, Craig. So I know the other principals are also working with their local teams to come up with very creative solutions. And so I appreciate that. One of the things we know that parents really want is a little bit more certainty about when they are asked to make a selection for in-person or virtual, to have a lot more detail about what it is they're selecting. So we heard the concerns when we did that last time in terms of the wanting to know, for instance, if I'm choosing virtual, is it going to be the same virtual experience my kids are having now, or is it going to look different? And if I choose in person, what is that experience going to look like for my children? And we understand that. And so part of what we will be sharing in that week or two after the Thanksgiving break is a lot more detail about what those things are going to look like, so that when we do ask you to make a selection for your learning choice for your children, that you will have a much better idea of what that's going to look like. So we also are very respectful of the work that the committee is doing, and we're very excited to see the final results from the committee. And so we have tried not to make too firm of plans at this point, but rather focus on kind of the broad planning of scenarios. So if the committee recommends something and it looks good, like something we can actually implement, we're in a good position to move forward with various different scenarios of implementation. So that will come up soon.
Can I say one more thing?
Yeah, please go ahead, Ruth.
I just want to speak to this at the elementary level, because I think it's important to be very clear that in order to do this, we have to let go of our attachment to our community, our classroom community. And so I just want to say that up front. So
Yep.
I know that, in this, at the secondary level, they're used to changing classes and having different teachers and whatnot. But at the elementary level, we become a family and we bring those kids in, and that's, your family group all year. And so I think that's been one of the more challenging things at the elementary level, is knowing that in order to do this, that we have to be willing to give that up a little bit. And so I just wanted to put that piece out there as well.
Yeah, thank you for clarifying that, Ruth. I do think that's an important point, because all of these things come with pros and cons. And I know you'll see some of that in the final report from the committee, because they've talked a lot about pros and cons like that. And so it is important to understand what on the surface sometimes look like simple solutions actually are rather complex and have a lot of pros and cons to them. So thank you for clarifying that, Ruth. All right, let's go back to our questions and see. There was one about working with City of Decatur, and this did come up in one of our subcommittees. We were talking about some of the changes Decatur has made. Both the pros, that at least in terms of the subcommittee, felt it was a pro that they were very adamant about a mask mandate early on, but also some concerns about things like the open alcoholic beverage rule and things like that. So I did share those concerns with our city manager, and I know they are balancing things just like we are. And I know that some folks in the community have reached out to them as well, to their commissioners and to the leadership of the city. So CSD works very closely with the city in many different ways, and we will continue doing so here. I know they are having to balance different things just like we are, but feel free, if you do have input for them, to reach out and share that with them, and we'll continue working with the city as well. Let's see. Question a little bit. This is a good one. What will happen if and when more students opt to return in person than a classroom is able to safely fit? So the first thing I want to talk about is a little bit of how are we figuring out how many kids can safely fit in a classroom? And so we put together some guidelines for principals and for their local COVID teams regarding how to begin estimating how many students can get put in place and still maintain a 6-foot social distance within a classroom. But every one of our classrooms is different. And so they did have to go through and look at individual classrooms. Greg, I hate to put you on the spot because you already stepped up, but I was just really impressed with the work Renfro did. Would you be willing to share the process you went through there to just the part of determining the how many kids each class could handle? You're muted.
There we go. Sorry about that. So we have, 100 or so classrooms, and, we had, I had records of, from previous documents what the square footage was of some of them, not all of them, and the ones I didn't have square footage of, I either used a tape measure or counted the blocks on the floor to figure out the square footage. So basically what I did was figured out, like, okay, here's like a 3-foot corridor for the teacher to use that has the wall of the active board. Okay, so just imagine like that wall with the active board and 3 feet for the teacher to kind of operate. And I put tape down on that 3 feet from that wall. So then what I did is that front row of desks, and overwhelmingly most of the rooms at Renfro have those seat desk combination unit things, right? So from that 3-foot line, I measured 6 feet to from there, and that's where the seat of that unit would be theoretically. It is above that seat, and then so that first row, those seats would be 6 feet from the 3 feet of that corridor. So that. Then I just did 6 feet, 6 feet, 6 feet from that. And then I chose one wall, most of the time, the wall that was not the door, the wall that contained the door, but like a window wall, and then did the same thing. So I had a column of desks, if you would, against that wall, and did 6 feet, 6 feet, 6 feet. So, I mean, I shared that spreadsheet with you. I've got a spreadsheet for every classroom that has its square footage and the number of desks that, using that method, that we could fit in each of students that we could fit in each classroom.
Awesome. Thanks, Greg. I appreciate it. And all the principals went through a similar process to that. I just looked at Renfro's today, so I just knew it had been done well. So thank you for jumping in and sharing that, Greg. So that's one piece of it, is where it gets to, as you see in this question about, it looks like they're set up to hold 12 to 15. That's where that comes from, is the principals going through that process and determining for any given classroom what it can hold. Now, the other part of this question is what happens if we then have more people. So like in the case of this question, you have 23 kids sign up for in-person, but you can only hold 12 to 15. So it's a great question. So one of the things we are looking into doing differently is giving a little bit more nuance in the learning choice survey. So you may recall, for those of you who are parents, you logged into your Infinite Campus parent portal and you had to select for each of your kids either in person or virtual. And we heard from many of you saying that while that worked fine, you wanted to be able to provide a little more nuance. Particularly, there were people who chose in person because that works well for them, but they also could keep their child virtual, to the exact point that this question is getting at. And so what we're looking at now is probably asking the question a little bit differently. Basically giving a little bit more wiggle room so you as a parent can express that there's a little bit more flexibility in your particular case if that is the case. So what we're looking at now are 4 choices. This may change, but basically one choice would be, I want my child in person no matter what. Another one would be, I want my child in person, but if you need me to keep them back in virtual, we can manage that. One would be, I want my child virtual, but if you need more people in person, we could manage that. And then finally, I want my child virtual no matter what. So that's the way we're leaning right now. That might change a little bit. And there may be some subcommittees may make some recommendations about that as well. But the concept behind that is that then we'll have a little better idea. So let's take this case. Of those 23 students, it may be that, let's say that classroom holds 12. And it may be that 14 students want to come back in person, but 5 of those 14 have said we can stay virtual. That now gives the school the opportunity to contact those 5 families and find 2 volunteers to get back down to that 12 to stay virtual. So that's the concept behind that. Just based on the results of what we have room for, and assuming that for the most part, if people chose face-to-face before, they'll choose it again. We're pretty confident that that will work out okay with the capacities that we have. But that's the idea there, is that we will keep the caps that we have on the classroom set and do our best to work with individual families to keep under that number using some other approaches. So that's the goal there. Are there any principals who want to add anything more there that I didn't hit on regarding the class sizes and things like that? All right. I'll also say it probably was obvious by how Greg was describing how it worked, but this is the reason we didn't set a universal class cap across the district, because every classroom is a little bit different. So instead we set some thresholds and had the principals figure out individually, because the sizes of our classrooms and the configurations of our classrooms are all very different. Let's see, we answered that and that. This question gets to the idea that Ruth Scott talked about, that we might have to re-roster and reassign students if we try to match up kids in person with teachers in person, kids virtual with teachers in person, or virtual, sorry. So that's what Ms. Scott was talking about. Why isn't CSD leadership meeting directly with teachers in schools instead of these large town halls? So, I mean, I'm assuming this is not meaning physically in schools, but more like staff meetings or something like that. And we are happy to do that. We'll come to any staff meeting where people would like us. What we are doing is we are meeting a lot with the, for instance, we have our teacher advisory council that has representatives from all the schools. And so we are meeting with them and having good discussions about what our planning looks like. And then we meet with our principals on a regular basis, and then they provide us input from their schools and also communicate back to the schools. But we are happy to attend any staff meetings or whatever that looks like. If the schools would like us there, and that would be fantastic. We, as many of you know, I really enjoy coming to staff meetings, and it has been challenging in this virtual environment, of course, because it's just such a different way of interacting, as we all know all too well. So, but yeah, we'd be very happy to do that. We talked about this one a little bit, but it looks like this question gets to that idea of concurrent teaching, where you have both students who are virtual and in person at the same time, and are there alternatives to that? So yes, there definitely are alternatives to that. And Christy, I don't know, do you want to talk about some of the things that we're looking at, or any of the principals want to step in? I can cover it if you'd like, but if any of you want to share anything.
Hi. Yeah, so I mean, as you mentioned, I mean, there are lots of alternatives. The alternatives would be, you know, hybrid, where students come either split schedule, partial days, partial weeks, partial or split days, split weeks, or alternating weeks. We could also look at dividing the classes, as we've discussed. I think you also mentioned that, having designated classes, both in person and virtual. and then the concurrent teaching model. So all of those, once we know the teachers that have the accommodations and the number of teachers that have accommodations, as well as the number of students returning, we can make the best decision about the model that will work best, and we can work out the details and make them work.
Awesome. Thank you, Christy. Ruth, I wasn't sure if you wanted to say something. I saw you come on there.
Yeah, I was just going to say, I mean, we kind of talked about that idea earlier. To me, also talked about, how we would designate virtual teachers and in-person teachers, but also at the same time, we are doing PL on concurrent teaching so that if we do have to do that, that teachers are already getting an idea of how that could work. So I think that like both of those things are going on right now, so that we can be prepared for whatever situation we might need to teach in.
Excellent. Thank you very much. All right, let's keep looking here. I think we've answered that one. That one. Can you address COVID cases in the pods? So great question. I'm assuming that implies to me there have been COVID cases in the pods. And one of the things I would just remind you is as we have cases, we put them on our reporting dashboard. And so that's where you would go to find information. We also have a communications protocol for how we let folks know about cases that would impact them. So Lily, I don't know, do you want to talk just a little bit about what our, how we communicate out what it is when there is a case, and how people learn about what is happening within cases in our school district?
Sure, no problem. So you already talked a little bit about the dashboard, which is where people can get information and have a picture of what's going on with everyone who's on site across the district. But if you are a person who is participating in an activity or in person, an individual who's diagnosed with COVID-19, there are a number of notifications. There's a notification for individuals who are a close contact, who are considered to have been within 6 feet of the individual who's diagnosed. And so those individuals will get a phone call from a nurse at the school, and they will be notified that way with a follow-up email. And then if you are in the class where the individual is diagnosed, you will receive a notification via email. And so that will go out to everybody in the class. We also have a protocol to notify the entire school community, and based on the scope of what's going on, that's how the chain of communication will flow.
Awesome, thank you. While the topic of pods is up, I am going to address one thing that I have heard questions about, and I recognize it's not up here, but it may be related, I'm not sure. And that is, there were some concerns about pods going away. And I think where that came from was we did shut down a pre-K pod at ECLC. It just was not working well with that age of student. And that was not COVID related. That was just, it wasn't a good environment for the kids the way that we were trying to do it. So we may be able to bring it back if we come up with some other way of doing it. But I don't know if that's related to this question or not, but I thought I might as well clarify that. That was not COVID related, that decision. What criteria will the district provide ahead of time for the decision making? Parents and teachers should not be surprised by the decision. It should be obvious what it will be based on transparent criteria. So great question. So that is part of the purpose of having our metrics subcommittee, is to look at what could those metrics be. So we know that there are lots of different approaches with metrics. We have some districts that have set a single number and said, if it's below this number, we're back. And if it's above this number, we're not back. We have some districts who have said, as long as the metrics for, say, cases are decreasing, that's all that matters. If they're decreasing, we stay. If they're not decreasing, we go back to virtual. And then we have some districts that have just not set metrics at all. And they just have decided to go back based on their ability to mitigate and things like that. So that's why we have these subcommittees. They have done a great job of looking into criteria like this. And I'm really looking forward to seeing their recommendations in terms of what metrics would make sense. What are the metrics we would want to follow as a school district, and what's our approach going to be in regards to metrics. So it is very a complex topic because coronavirus is new. And so there definitely is debate in the scientific community about what those metrics should be and what they tell you about the risks to opening schools to in-person learning or keep staying virtual. But it is something that we are looking forward to hearing back from on the metrics committee. So we will share all of that right after Thanksgiving, whatever comes out of that committee's work, and then our implementation of those recommendations based on what we hear from them. So commit to making a decision that has a complete set of contingencies. So we definitely are trying to approach our next phase a little bit differently in that we do have, we are hoping to communicate better if A, then B, if C, then D, that kind of thing, so that it is a little bit more clear for folks exactly what's going to happen. We heard loud and clear from our teachers, for instance, about that need for predictability and understanding what's happening. I've heard from lots of parents that just want to make sure we've worked up what are our different contingencies for different scenarios. So it's one of the reasons that we are onboarding a bunch more teachers. It's one of the reasons why we are hiring more support staff to make sure that we have contingencies in place. So that whichever direction it is that we need to be going, we're ready to move that direction. So I'm not sure we'll be able to foresee every contingency, but we will do our best to predict those. And I know some of the subcommittees were talking about that as well, to figure out what it's going to look like when we come back. So some samples of contingencies that you may be interested in, just so you have a feeling. So for instance, we may have a recommendation that says something like, if your metrics are in this range, then you can safely have maybe a hybrid rollout. If your metrics are in some other range, you can safely have a more kids, but still have all the normal mitigation measures in place or something like that. So we're trying to work on the plans for what those things will look like for those scenarios. We also have to worry about what happens as we come back. We know that the new administration coming into Washington has already formed a COVID team. And so we are eagerly anticipating what that team is going to do. And so we will need to be flexible, because it's quite possible they'll come out with some recommendations, or maybe not even recommendations, maybe requirements, I don't know. And so we will need to be flexible and adapt to whatever comes out of Washington as we transition to a new administration. So there's a lot of things that can still happen. I know many of you would probably join me in my pleasure that we are seeing vaccine results coming back that look very positive. And I am extremely hopeful that as we move into the next calendar year and moving into the spring, that we're actually able to get these vaccines out and distributed and administered in a way that it will provide new opportunities for us as we move forward in our operations. So we completely understand the desire for certainty. We feel it, we know you feel it, and we will do our best to provide as much certainty that we can in a really uncertain time. And we will continue doing that. I know it is very difficult. The times are challenging enough. They're even more challenging when we do have to be flexible and we do have to change plans, and we understand that, and we will do our best to communicate our intentions as clearly as possible, and to make sure that we're hopefully it's not a surprise, whatever direction we end up going as we review all of the input and make our next decisions. So, but at the same time, there are things that could set our plans aside and we would have to adapt to. So I don't want to make a false promise that we can absolutely have certainty, but we will provide as much certainty as we can. Anybody on the team want to add anything else to that before I move on?
Dr. Duty, if you don't mind, I just wanted to also add, another caveat that comes up a lot as we look at bringing students and teachers back into our buildings, even if we decide, if or when we decide to do that, if the community transmission rate is high, we're going to have a lot of staff that has to quarantine just because they've been exposed in their household or in their community. And we're going to have to make sure that as we make these contingency plans, additional staffing is ready to cover for all these staff that may be exposed in the community. So that's another caveat that I think as we plan hiring all the additional staff that we're thinking about, trying to keep on our pod facilitators as we welcome students back into classrooms will be really important for us to continue that process.
That is a perfect segue into, I was just looking at the time, and so thank you for that. That was very good timing because I want to share just our current data and where we are right now. So I want to show you a couple things. And as we're looking at this, I want to emphasize exactly what Maggie was just mentioning is it really is, it's our whole community that it's going to take to make this happen. Because even if we are doing everything right within the school district, if we can't staff our classrooms, we can't function. And so I just share this from our data dashboard, which you can also find on our website. Our cases are going up. You may recall we were right about this point of our graph when we had to make a decision last time, and we made the decision that it looked like the cases were going to start going up again. And so we stayed virtual, and unfortunately the cases did go up again. And so we are seeing that rise in DeKalb County. Looking at our percent of positive tests, for instance, we are seeing an increase there as well. So I just want to emphasize how important it is for us to be responsible community members and doing our best to just be very careful and trying to do our best to help control this virus is going to help considerably. And then I just wanted to share, I got the request many, many times over. So I wanted to show you very quickly, if you ever want to compare counties, I did add in graphs that compare counties together, and you get to it by going up to the page and clicking on county comparisons. It takes a little bit to load because there's a lot of data there. While that's loading, I'll tell you, if you ever want to look at different dates, some people ask me, well, I want to look at a certain time period. You can do that, by the way, up here in the corner. But anyway, here is a comparison. This is cases per 100,000. And this is the red line is Cobb County. The gold line is DeKalb. The green line is Fulton, and the blue line is Gwinnett. And so you can compare how the different counties are looking in terms of cases, in terms of the percent change in new cases, and also in the terms of the percent of tests that were positive. So that is a new addition to our data dashboard. We update this every couple of days with the latest data from Department of Public Health. So please feel free to check back here. But that was a popular request. And so I wanted to make sure you guys knew that was there. So I can't thank you all enough for coming to our first town hall. We will go through the questions we didn't get to and do our best to put together answers and share those so that we can get that information out as well. And there are some other things within our Thoughtexchange the tool that can help us look at the data in different ways. And so we'll be sharing some more information about that so you all can see what we've learned from your questions. So I really appreciate all the time and effort you all put into providing some really good questions for us to answer tonight. We will plan to keep doing these town halls on a regular basis as long as we need to, as long as there are still questions out there that need to be answered. And so we will probably do another thought exchange coming up to that next town hall the Thursday after Thanksgiving break. So watch for additional communications in that area. And we just really look forward to your participation. And I think that's it. So thank you all very much. Really appreciate all of your contributions to our questions. Please keep providing your feedback. We read every email we get. We can't respond to every single one personally often, but we just really appreciate the feedback you're giving us. So thank you very much. I hope you all have a fantastic Thanksgiving. We've got a lot of hard things going on in our community in many different ways. I hope you're able to take a moment and be thankful for what we do have, and spend some time, even if it's over Zoom or something, with your friends and family, hopefully, and do be safe this week, please, so that we can help keep our cases down in our community. So thank you all so much. I hope you have a great night, and I hope you have a great Thanksgiving, and we'll see you again in a little over a week.